My name is Rebekah Hanson. I work at the University of Illinois. I'm a clinical pharmacist there, and my primary role is I actually work with the pulmonary hypertension clinic. Because I work in that clinic with Dr. Machado, I see a lot of overlap with our scleroderma patients. And in fact, I have the honor of working with Dr. Swice on a regular basis and helping manage some of the medications for her patients. So what I'm going to be talking about today is some of the medications that you may commonly see. Here's the hospital I work at, just a little bit of information about it. What I do want to mention though is that I'm going to be speaking a lot about these medications and off-label uses, so they are not currently FDA approved, with the exception of some of the over-the-counter medications I'm going to be talking about a little bit later on. For the essence of time, I'm going to try to speak in more general terms about the use of these medications, and then try to point out some specific, more important information about each individual drug. And I also want to mention that I'm by no means an expert with scleroderma or scleroderma management. What I know compared to the other speakers is marginal, but I do work a lot with these therapies, so I think I can point out some information that's going to be really helpful for you. This is what we're going to try to cover today. Discuss the important considerations for some of these therapies that are used with scleroderma. We're also going to try to review some of the characteristics of commonly used medications for symptom management. Shockingly, I'm going to be talking about some of the drugs that are commonly used with pulmonary hypertension, but also have uses with Raynaud's. We're going to look a little bit at natural medicines and how to balance risks versus benefits of supplementing with natural products. All of these objectives are based off of questions that came in from you. So I asked Stephanie initially what to talk about in coming here today, and she sent me a whole list of different questions, and I realized most of those questions were related to toxicities of medications, possible side effects of medications, as well as drug interactions. So I'm covering these today. I don't want to scare you by any means, but these were the most common questions, so these are the things that I'm really going to focus on for the purposes of our talk today. And what I also want to mention when talking about some of these medications, a lot of these therapies are used for other indications. Obviously, in fact, many of them are used for suppressing the immune system for transplants, for organ transplants. Many of them are also used for chemotherapy. And in those circumstances, the doses are exceptionally higher, most commonly, than they are used for more immune-related conditions like rheumatoid arthritis or some other autoimmune diseases. So when we talk about the toxicities associated with them, it's more in relation to those really high dose uses of the drugs. However, it is still really important to keep these things in mind, because even at lower doses with long-term use, you may potentially see some of these toxicities develop. So we'll cover those today. These are just some of the drugs I'm going to cover. I may skip through some of these slides. When I work through some of these slides, you see that there's going to be some common themes with the use of these medications. One of them is immunosuppression. That's kind of the purpose of using these drugs, right? But there's some caveats to causing an immunosuppressed state. So we'll talk a little bit about that. Some of them are going to be myelosuppression as well, which can, by that I mean compromised bone marrow, or active bone marrow, I should say, which can lead to some of the toxicities and side effects, as well as kidney impairment and potential for hepatotoxicity or liver toxicity. So because most medications are absorbed in the gut, they might be activated by your liver, and then they may be either cleared in the bloodstream or cleared by your kidney. If you have compromised states of either one of those areas, it could potentially affect how you respond to a medication, and it could affect you having any possible side effects or toxicities associated with it. In addition to that, it may also be affected by other drugs that you take. Methotrexate, very commonly used medication. It's used for a whole wide array of various different indications. This is actually one of the very first chemotherapies available, and it's still used today. It was available way back in the 1950s and has been used frequently since then. For most chemotherapy indications or oncology indications, it's administered intravenously instead of orally, and in very high doses. What we see for most of the immune-related conditions are lower doses, which tend to be more tolerable. This particular medication works by inhibiting an enzyme called dihydrofolate reductase, which coincidentally is also the enzyme that converts folic acid to active components, and these components are actually necessary for normal cellular function. Some of those functions include just regular metabolism as well as proliferation or replication. So that's essentially how it works with chemotherapy, or for most oncology-related indications, but it also has a secondary effect where it suppresses the immune system. Now, it tends to be non-selective, So it can suppress and prevent proliferation of normal healthy cells, particularly cells that tend to rapidly divide. So cells that are in your gut or in your mouth or in your hair. And that can lead to some of the side effects that you see with methotrexate. Some of them are listed here. For indications that are related to immune suppression, it's typically dosed once per week. That's really, really important to know, because if it's taken daily, that can actually lead to some really serious complications. Make sure to follow the instructions when you're talking to your doctor if this particular medication is prescribed by you. Based on the mechanism itself, that's actually one of the reasons why folic acid is supplemented with the use of this medication. It's because when you supplement with folic acid, you're actually helping to counteract some of the potential side effects that are related to the use of this medication. So the side effect like mucositis, for instance, the ulcerations in the mouth, that can be prevented or at least significantly reduced with the addition of folic acid. Some of the risks associated with this medication, it's one of those meds that is activated in your body, and it can go through various processes. One of the processes can result in liver toxicity. So because of that, it's really, really important. You probably may have talked to your doctors about getting lab monitoring done with this medication. And liver function tests are one of those labs that are done usually more frequently at the very beginning and then less frequently over time. And then also because of the bone marrow suppression, there is a potential risk for bleeding. That's also more common with the much higher doses, but is a potential concern with even more doses like 12.5 up to 25 milligrams per week. Now, with poor kidney function, this is just something to keep in mind if your kidneys aren't clearing things as well as they should, because methotrexate can actually build up in your body and result in a toxicity if you've got poor kidney function. Now, what I really want to talk about are some of the drugs to potentially avoid. Because of the effect that this medication might have on liver, it's highly, highly recommended to have your doctor double check your medications to see if there are any other drugs that can potentially affect your liver as well. Those should be avoided. Of course, alcohol should be avoided as well. There are a couple of medications that may affect clearance in the kidneys, which might increase the levels of methotrexate. Probenecid is one of them. So that's something to keep in mind. There are also some loop diuretics or water pills that might potentially interfere, but the effect with the lower doses that we use it is usually not that high. So what we usually monitor because of that are liver function, complete blood count, your creatinine, and also because this significantly suppresses the immune system, we'll check your white blood cells, and we'll also probably check for a baseline TB and maybe some other tests to make sure that you are, basically to assess your level of risk for infection. Now, mycophenolate, this one works by reducing the activity of B and T cell lymphocytes to suppress the immune system. Typically, it's dosed starting at 500 to 1,000 milligrams twice a day, depending on what your doctor prescribes. Now, this one, when it's used for transplants, which is what one of the original purposes of this medication was, that's where we're more concerned with blood levels. For more of the immune-related conditions, it's typically more dosed on a more traditional basis or a regular basis like this. So the blood levels may not be as much of a concern for these purposes. Now with this, it's highly encouraged to take it on an empty stomach. The reason why is because food can interfere with how this medication is absorbed. It might lead to lower blood concentration, so it's highly recommended to do that. But unfortunately, that can also lead to a lot of GI-related side effects. This also suppresses the immune system, so infections are a risk, and it also can reduce some of the blood components that we're looking at as well. We potentially do a lot of similar testing with this, such as CBC, testing for potential infection. You know, one thing actually I forgot to mention about methotrexate is it's also considered a teratogen. Has anybody heard that term before? That essentially means that this is a medication that's known to cause birth defects. Mycophenolate is also a medication that's known to cause birth defects. So because of that reason, it's recommended that women that are childbearing potential use methods of contraception to ensure that they don't become pregnant. So we may do a baseline pregnancy test to assess to make sure that they're not currently pregnant, and then recommend or encourage certain types of contraception for use with this medication. Now, even if you're not of childbearing potential, this still might potentially apply to people that are in your household. What I mean is if you have someone living in your house or that visits regularly that is of childbearing potential and is exposed to these medications, there is a potential concern that it may affect them as well in that capacity. So what we usually recommend is that anybody who is of childbearing capability, if they're to handle this medication, just take certain precautions. The risks are really low if you're not consuming it, but the risks are still present. So what we say is to potentially use gloves or certainly use really good hand washing procedures if the medication needs to be handled. Drugs to avoid. This particular medication can actually be affected by quite a number of medications because of the way that it's absorbed. There are a group of medications called phosphate binders, which may potentially reduce the absorption of this medication. Regular antacids might reduce the absorption of this medication. And then some medications that are used to treat bile acid sequestrants or cholestyramine may also reduce the levels of this medication. Just make sure that your pharmacist or your physician double checks your medications and makes any appropriate adjustments that would be necessary. Glucocorticoids. You've probably heard of prednisone. It's a commonly used medication used for a wide array of different indications. It's used short-term, long-term. This medication is really good at suppressing inflammation and really good at reducing the immune response. And it does this through multiple different mechanisms. Prednisone, however, is essentially a hormone that's responsible for a lot of protein metabolism processes in your body. So when this medication is around, hanging around in your system for a long time, your normal occurring processes tend to get lazy and they tend not to work as well. So with this particular medication, it does is it can have some long-term effects. So if you've ever used this medication, your doctor may recommend eventually trying to reduce the dose or potentially get off the medication over time. That's one of the reasons why. It is encouraged to take it with food. Typically with short-term use, we don't really see a lot of side effects, but with long-term use is where we see more of the risks associated with prednisone or other glucocorticoids. Abrupt withdrawal should be avoided. The reason why is because those processes that got lazy essentially can go all out of whack when you suddenly stop the medication. Some of the potential side effects, most of them are related to their long-term use. So some of these could be fluid retention, which might lead to increased blood pressure. It can also potentially cause mood changes, stomach-related upset, diarrhea, acne, hair loss. With long-term use, we're mostly worried about blood glucose. It can potentially cause diabetes in some people. And we're also worried about potential for the effect that it may have on bones. So there's some evidence that prednisone and other glucocorticoids may affect how calcium is absorbed in your body, and it may actually affect how vitamin D, the other component of normal healthy bones, works in your body. So because of those two factors, over time, this medication has been attributed with osteopenia and osteoporosis, particularly with high doses. So if you're on the lower doses, for a shorter duration of time, it's usually not as much of a risk, but the higher doses for long durations of time, you may be considered for supplement with calcium and vitamin D, maybe potentially use with some bisphosphonates, which is a medication that helps promote bone repair and preserve bone function, as well as you may be recommended to get a bone mineral density or a bone scan, essentially to see if there's any damage already. Some medications to keep in mind are other immunosuppressants. This medication is affected by thyroid medications potentially. Warfarin, it may actually increase the INR. I'm not sure if you're familiar with warfarin, a blood thinner and anticoagulant. We do a blood test to see if it's within a certain range, and it can actually make it shoot up and outside of that range. Cyclosporine, this is an alkylating agent that has cytotoxic effects, so it basically stops that cellular proliferation. Interestingly, it is a derivative of nitrogen mustard. Many uses, including in cancer and autoimmune diseases. With this particular medication, it's recommended to take in the morning, and if you're taking it using capsules, don't open the capsules. They would need to be extemporaneously compounded, but you don't want to get exposed topically to this medication. Also, it's really important to drink a lot of water. This particular medication is associated with an unusual complication. It can actually cause some toxicity in your urinary tract, and it can cause something called hemorrhagic cystitis, which is a serious complication that we want to avoid, but it's usually pretty easy to avoid by just consuming a lot of water to excrete the component that's causing that injury to the urinary tract. Some of the potential side effects, they're mostly blood related. It can reduce platelets, red blood cells, and white blood cell count. It can cause hair loss, and it can actually cause low magnesium and sodium because of the high amount of fluid that you're drinking with the use of this medication. Typically, we'll monitor CBC, electrolytes, and urine. It can also cause some infertility associated with use of the medication in men and women, so there may be certain precautions that we take related to that. And then some of the medications to avoid, any drugs that also cause bone marrow suppression can lead to additive effects with this medication. So those should be used cautiously, as well as other immunosuppressants. Bupropion, which is a medication that's used in smoking cessation, as well as for some mood-related issues. That particular medication can increase the levels of cyclophosphamide, so use cautiously. In fact, it's usually recommended just to avoid. And also, interestingly enough, if you're going to be undergoing any type of a surgery that requires sedation or a neuromuscular blocker, basically the medications that keep you still during surgery, that can cause a very serious interaction as well. So typically there's a certain period of time that you need to be off of this medication before undergoing any surgery. So just keep that in mind. Azathioprine is a prodrug of 6-mercaptopurine, which is a very good immunosuppressant. It's really important to test for this particular enzyme, this TMTP, because if you're deficient in this enzyme, it could lead to toxic levels. We do monitor LFT, CBC, renal function, and for infection. Nausea is the most common side effect, and it leads to a high rate of discontinuation. If you do experience nausea with this, you can take it with or right after meals, and that should help with that potentially. Most of the toxic effects are related to liver and blood. With this medication, some interesting drug interactions, ones that you might not even think about. ACE inhibitors, which are very, very commonly used for blood pressure. They're used to protect your kidneys. There's a very serious drug interaction with azathioprine. It's really highly recommended to either avoid that use or very closely monitor, because those two drugs together can lead to a really high rate of bone marrow suppression and leukopenia. And then also allopurinol can lead to toxic levels of this particular drug as well. That's a medication that's often used for gout. And cyclosporine, this is actually the first drug to improve transplant survival. It's a product of soil fungus, and because of its effect on T cells, it results in a very profound immune effect. This particular medication should be taken consistently throughout the day. It's also recommended to avoid UV or sun exposure because it leads to certain types of potential malignancies later on. This actually has a lot of potential side effects and a lot of potential drug interactions, which is why it's kind of fallen out of favor. You may not have even seen this used frequently. This causes a lot of kidney toxicity, and a lot of other medications either affect the kidney or are removed by the kidney. So when you use that medication in combination with this one, it can lead to some very serious effects. So we aggressively monitor kidney function if you use this medication, and then aggressively look for other medications that you might be using to see potential effect. Now, this medication actually has some what we call contraindicated medications, which means absolutely do not use these together. Bosentan, which is to clear, it's a medication to treat pulmonary hypertension, is an absolute no-no with this drug because of the increased levels that occur with the cyclosporine. Grapefruit juice, some statins, which are used to treat high cholesterol, colchicine and allopurinol as well. Those are two medications used for gout that should absolutely be avoided. This can cause a lot of unusual side effects as well, including alterations in your electrolytes. It can increase your cholesterol. It can lead to the gingival hyperplasia as well. Similar to calcium channel blockers, it can cause that effect. And acne rash and hirsutism or excessive hair growth or some other potential side effects. I'm going to speak about the PDE5 inhibitors. This is a medication that we see used frequently in Raynaud's. So to treat circulation problems, the symptoms of Raynaud's, or potentially help reduce or prevent or heal digital ulcers. There's actually a lot of evidence for use with this particular medication, and most of the studies have been done in people that didn't respond to other potential medications like calcium channel blockers or some of the other more common medications that you might see. This is also a really common medication used in pulmonary hypertension. It works by disrupting an enzyme that would normally, and promotes a process of vasodilation. It can increase capillary blood flow, decrease attacks, and provide symptom relief like pain and cold. Medications to avoid, because of the way that it works along a similar pathway as nitrates. So medications that have nitroglycerin in them, typically used for chest pain, should absolutely hands down be avoided with this drug. Some of the potential side effects are related to how the medication itself works. So it can cause headache, flushing, heartburn, and so on. Endothelin receptor antagonists, so medications like Bosentan, Tracleer and Macitentan. They work by blocking endothelin. These medications are typically hard to get. They have to go through a restricted process, and they come from a specialty pharmacy, which means that you are enrolled in a program and then you get the medication from one of just a handful of pharmacies. And the reason why is because of the potential risks associated with these medications. They can cause birth defects, which is something that's aggressively monitored. One of them, Tracleer, can also cause some liver injury, so that's aggressively monitored as well. The problem is they're very expensive, so a lot of insurance companies might be somewhat difficult to get them covered. And then prostacyclins, so medications like treprostinil or epoprostenol or iloprost also are potentially used in this indication. These medications are a little more challenging to use though because they're typically infused by a small pump, and you've got to be trained on how to use that pump. And they're also quite expensive, so sometimes difficult to get approved. It's a theoretical interaction that proton pump inhibitors could potentially reduce or delay the absorption. But there's some drug interactions that are considered clinically relevant, and with that particular interaction, because we're not monitoring levels and we're not suppressing the immune system for an organ transplant, it's not quite as relevant. The question was, if you start on Viagra or sildenafil, which is one of the medications up here, the potential side effects, are they to occur just when you take the medication, or are they something that you should expect all the time? So with indications for using this with Raynaud's, it's typically taken on a scheduled basis instead of an as-needed basis. So you're going to be taking it 3, maybe even up to 4 times a day. Typically, the medication related side effects that you have, most of them you'll experience, if you experience them, I should say, but most of them are experienced when you first initiate on the medication, and then they tend to attenuate over time or become more mild over time. Most of the side effects, what I usually see, headaches are one of the biggest challenges. So for some people, what we'll do is we'll start them on a lower dose if they've got intolerable headaches, and then slowly increase the dose over time to a dose that they can tolerate better. So with these drugs, there's really no race to get to the finish line. So if we need to start a little bit lower and increase up based on how you tolerate it, that's okay. And then typically it takes maybe a month or 2 tops for those to start to go away or to become more mild. The answer is yeah. I mean, that's how they work. So the medications that you're the loop diuretics specifically, the Lasix, that medication, the way that it works is by making your body increase the amount of fluid that it discards. So if you're not urinating, it means that the medication isn't working. Where it gets really tricky is if you have any type of urinary incontinence, because this is only going to potentially aggravate that. So oftentimes it would be potentially encouraged to see a genital or a urinary specialist to see if they have recommendations to better control the overactiveness component. But yeah, with the loop diuretics, that's how they work, and unfortunately there's really no benefit to them if they're not increasing urine production. The spironolactone actually has a couple of different mechanisms. One is helping to reduce the water, so that may actually still continue to provide some benefit, but with the other ones like Lasix, it's their primary mechanism. Vitamin D is a fat-soluble vitamin. It's available from many, many natural sources, and it's actually naturally produced in your skin as well with exposure to sunlight. There are some prescription products as well as over-the-counter supplements. Whichever one is required or most appropriate for you will be recommended by your physician. Vitamin D is required for appropriate calcium action, so it's required for absorption as well as how the calcium functions within your body. That's its primary purpose. It also is responsible for a lot of other processes in your body that we're not even really 100% familiar with, but this is probably the most common one. Vitamin D it essentially works like a hormone in your body that needs to be activated through multiple steps, and I actually put in a slide in here to kind of talk a little bit about the differences in formulations and how they're activated in your body. And there's also multiple formulations and dosing options. If you have a vitamin D deficiency, it's typically started with a lower dose and then is titrated based on how your levels come out. So how frequently those levels are checked, it really depends on what you're being treated for. Depending on how low it is, it could be anywhere from 1 to 3 months that your doctor is going to have you come back for follow-up to get those levels checked. And then typically the dose is adjusted from there. Vitamin D is also, when you go to the store, you might see two different ways that it's labeled on the bottles. So one way is in international units, the other way is in micrograms. So the rule of thumb is 1 microgram is equal to about 40 international units. So if your doctor recommends international units, but you see it dosed in micrograms, that's the traditional conversion. International units, or IUs, is the more common representation. This is the schematic for how vitamin D is synthesized. You can get it through exposure to the sun, so there's something in your skin that's produced to cholecalciferol, which is vitamin D3, which is activated by the sun. You don't have to have a lot of sun exposure. In fact, an exposure of about 30 minutes a week is usually enough for normal people with non-deficiencies to produce enough vitamin D for all of their normal processes. For some people, it may be a little bit more. And then you can also get it through food consumption. Fish liver oils, or like cod liver, is very high in vitamin D. There are some other fatty fish, and this also supplemented in a lot of products like cereal, milk, and then you can also take it in supplements that you just buy over the counter. Vitamin D, once it's converted to either cholecalciferol in your skin or absorbed as ergocalciferol vitamin D2, is then activated by your liver, undergoes further activation by your kidney, and then goes on to its biological target to do its effect. I just wanted to put up my email address here. If you do have any other questions on what I put in the slides, I'd be happy to further explain or add some more information to it, okay? All right, thanks.